of COVID-19 during this pandemic. In the past 24 hours to 12 noon today, there have been an additional 475 cases diagnosed. In New South Wales, there have been 14 additional cases, 3 of those related to hotel quarantine. 10 have known links to existing clusters of COVID-19 within New South Wales, and 1 case is a locally acquired case of COVID-19 whose contact is not yet identified. Victoria today reported 459 additional cases. 82 of those were known contacts of people with COVID-19, and 377 remain under investigation. There are 241 people nationally who are hospitalised with COVID-19, and 41 are in intensive care units. 155 people have lost their lives to coronavirus disease. 10 additional Australians overnight lost their lives to COVID-19. The situation, of course, in Victoria has us all deeply concerned. The numbers continue to fluctuate in the 300s, in the 400s. Today, a number of 459, which not quite approaching the peak, but certainly close to the 490 that we saw several days ago. What isn't happening, of course, is that those numbers are not doubling on a week-by-week basis, we have reached a relatively steady state for the moment of numbers between about 350 and 450 per day. This certainly reflects the effect of some of the initial restrictions that have been brought in. And we need to keep in mind, of course, that we are only 2 weeks from the stage 3 restrictions, just over 2 weeks since they were brought in, and of course the mandatory mask wearing policy in Greater Melbourne and Mitchellshire, which was implemented some 5 days ago. So whilst we are deeply concerned, we are obviously watching the numbers with interest. This is a truly national effort. We have the Australian Defence Force, which has made a significant contribution at the request of the Victorian Government, with over 1,400 ADF personnel in Victoria at this point in time, assisting with a range of activities. The contact tracing has been ramped up to extraordinary levels, both within the Victorian Department of Health and Human Services, but assisted remotely by colleagues and public health officials around the country. And additionally, we know that if additional resources are required from the ADF to the Victorian Government, that they are available, that additional ADF resources are available if Victoria needs them. I want to dwell on the situation in aged care, which is obviously occupying our minds, the minds of families of those who have loved ones in aged care within Victoria at the moment. The Minister for Health, Minister Hunt, and the Minister for Aged Care, Minister Colbeck, announced yesterday the Victorian Aged Care Response Centre, which builds on many weeks of collaboration between the Commonwealth Department of Health and various other organisations to formalise a response centre dealing specifically with aged care and the challenges that several aged care centres are meeting against COVID-19 at the moment. This announcement is in clear response to the gravity of the situation, particularly in a smaller number of aged care facilities with many cases of COVID-19, where we need to work hard to bring things under control as quickly as possible. That is a broad-ranged collaboration led by the Commonwealth Department of Health and Emergency Management Australia, which of course is housed within the Department of Home Affairs, a close collaboration between the Commonwealth and our Victorian colleagues in Emergency Management Victoria and the Department of Health and Human Services, with assistance from the Australian Defence Force, with leadership as well from the Aged Care Quality and Safety Commission and the Commissioner, Janet Anderson, and of course in partnership with the aged care providers in Victoria and with families of those and of aged care residents themselves. This is a challenge that we all need to work together to meet quickly, for the safety of those who are vulnerable and dependent on care within aged care facilities in Victoria. There have been calls, of course, from some sectors of the community for all residents in very affected aged care facilities to be removed. One of the things that I've learnt as a clinician and assisting with the response as Deputy Chief Medical Officer is that every single outbreak is different with regards to COVID-19, that it affects different facilities in different sort of ways when we're talking about aged care. And as anyone, like myself, who's had a relative in residential aged care in Australia, my father was in 3 aged care institutions, they're all very different. And if I reflect back on where Dad was, I could quickly appreciate that COVID-19 would behave very differently in those institutions, based on the number of people who were together in rooms, based on the number of single rooms there might be, based on the level of acuity of care for those aged care residents, some of whom have very advanced dementia and behavioural issues as well as other care needs. And so what that means is that it's very difficult to apply blanket approaches across different facilities. They require an individualised response. They require a coordinated response where we can, as with the Victorian Aged Care Response Centre, make sure that the right decisions are made for each individual aged care unit. And then, of course, decisions need to be made for individual aged care residents, both those whom are COVID-19 positive and others who may be suffering because of their high care needs and the effects that the workforce disruption is having on them. The important thing to note there is that decision-making for individual aged care residents is a shared decision between themselves, if they're able to make it, their families, and of course, healthcare practitioners. And those aged care residents who are suffering from COVID-19, who require hospitalisation, will of course be hospitalised. But that decision needs to be made by the treating clinicians. Every aged care resident in Australia has their own general practitioner. Be intimately involved in those decisions, the receiving doctors at the hospital, the wishes of the aged care resident and the families. And I wanted to make that clear today because it is important that people understand that there is no blanket approach, that these approaches need to be tailored, individualised and effective. And with that in mind, I'll take questions. Tamsin.
Just on the aged care situation in Victoria, last week Alison McMillan visited one of the sites that have had particular issues, and she said she heard of cases where workers there had tested positive but they'd been entirely asymptomatic. What's your understanding of asymptomatic cases in Victoria at the moment, and what's the current advice on their ability to have or spread the virus?
Alison McMillan has, as you know, is the Chief Nurse and Midwifery Officer. She's been taking an absolutely key role in this. Both Alison has extensive emergency management experience and, of course, is one of our country's leading nurses, in fact, the leading nurse of the country. Alison's comments there reflect the fact that COVID-19 has a known pre-symptomatic period. That for 48 hours at least before someone starts to develop symptoms, they are able to have virus within their upper respiratory tract and transmit it to people. That makes it a very challenging situation where you've got a workforce that absolutely has to be at work to care for these individuals, but may well be incubating the virus, may well be in a pre-symptomatic phase. So whilst we don't have data specifically on the number of people who are asymptomatic, it is certainly a challenge of COVID-19. And one of the reasons why when we look at the numbers and we say that there are over 500 individuals affected with COVID-19 in aged care in Victoria, that it's about 260 of those are residents themselves and 260 of those are staff. So a very challenging situation. Claire.
The cases in Victoria today, 377 under investigation. That's about 80% of today's cases. Overall, they've got about 3,000 under investigation. What is the impact if those cases aren't traced within 24, 48 hours? What is the window? And presumably of those 3,000, many have surpassed that window. What's the risk that there is now a lot more exponential growth of this virus in the community to come?
So I think it reflects a few things. So you spoke of when we say on a daily basis now that there's a significant number of cases in Victoria under investigation, then in the ensuing days, the contact tracers down there are trying to make those links between the various outbreaks. And as we've heard from Professor Sutton, I believe there's over 100 separate outbreaks and clusters down in Victoria at the moment. So that is a very challenging job indeed. It's certainly not to say that those 377 haven't been contacted. It's been very clear in the past few days and indeed weeks that the focus has been making sure that people who are diagnosed are contacted on the day of diagnosis. And that is absolutely critical. And I think one of the things we've heard, which has been very encouraging, there are challenges in calling people and getting in touch with them. Sometimes they may not answer the phone. And of course, now we know that if people don't answer their phone, they will be contacted in person. And the ADF is supporting us with that. So in actual fact, the most important thing is once you get a diagnosis, someone is aware of that diagnosis and then they isolate. Then, as you say, it is desirable to be able to trace the contacts as quick as possible. And it certainly does have an effect when that contact tracing takes a few days or potentially you can't find the links. So the tighter the contact tracing is, the easier you get, the quicker you get on top of these transmission chains. I think the reality in Victoria at the moment, what we're seeing with the increased emphasis on contact tracing, there are literally thousands of people who are involved around Australia. And what we will see is as these numbers come under control, those contact tracing times will come down and it'll be easier to find those contacts in the quickest possible time. But there's no point in saying it's not a challenge. It is a challenge when you get to these numbers, and it is something that would challenge any jurisdiction in Australia, which is exactly why we're offering the extensive support that we are to Victoria.
One of the things that National Cabinet agreed to on Friday was a more centralised, open, transparent sharing of information, data beyond case numbers. What data will be now shared between the states and the Commonwealth more freely? And isn't that implicitly saying that that information wasn't being shared potentially in the case of Victoria and it would have been more valuable had it been made open to other states earlier?
No, I don't think it's fair to suggest that National Cabinet agreeing to a set of standards implies that that information wasn't being shared with the AHPPC prior. We've been in long discussions and Professor Sutton and his colleagues give us extensive information about the situation in Victoria, including their challenges with regard to contact tracing and other things. This is how we've known that we've needed to be able to support them. So certainly those numbers now, those new key performance indicators which are part of the Pandemic Health Intelligence Plan will be very important to be able to assess response. They will indeed involve things like the time taken between someone getting a test and to it being reported.